Hi, folks, and welcome to another episode of Health Talk from Marz. It's out of this world. In today's episode, I want to talk about one of my favorite nutrients that's very poorly understood. Most people know vitamin K as a nutrient that's involved in blood clotting, but what they don't know is its effects on making bone, healthy bone in the body, as well as an anti-inflammatory agent, and also preventing kidney stones. So if you want to learn more, stay tuned. So vitamin K was discovered by researcher Henrique Dam in 1934, and it was named vitamin K because the word for coagulation starts with a K in Danish. So this vitamin was a critically important nutrient for blood clotting. Beyond blood clotting, vitamin K is intimately involved in bone formation, also at reducing inflammation in the body and preventing kidney stones. There's three basic forms of vitamin K. Phytonadione, also known as phylloquinone, and that's K1, and there's K2, of which there are a number of different forms. The two main forms that you need to be concerned with are MK4 and MK7, and they're both intimately involved in bone health. And the third one is menaquinone. Menaquinone is a synthetic derivative of vitamin K, used in only certain circumstances. So where did the different forms of vitamin K come from? Well, 90% of our K1 comes basically from our diet. Green leafy vegetables such as broccoli, asparagus, kale, spinach, which again, most people are quite deficient in. And when we look at K2, K2 is found in fermented foods such as sauerkraut, kimchi, but especially natto. Natto is a fermented soybean that has extremely high levels of MK7. It's one of the great sources. Also, MK7 and MK4 come from the digestive tract, specifically the colon. Depending upon your microbiome, so people that have taken, a lot of antibiotics, or people that aren't getting enough fiber are not generating the proper microbiome to produce MK4 and MK7. So this is a underrated and really important source of our vitamin K. And lastly, K3 is menaquinone. That's a synthetic analog of vitamin K, only used in certain medical conditions. So vitamin K in its key forms, this is what you really need to know. MK4 and MK7 have different periods of time that they act. MK4 is rather short acting, only an hour or two, whereas MK7 is much longer acting and usually 3 or 4 days or so. So when you're looking at a multivitamin supplement, you want to make sure that your formulation has MK7, which is longer acting and is especially involved in the formation of a special protein called osteocalcin. So what's osteocalcin? Osteocalcin is a critical protein in your bone that's responsible for binding calcium ions. If you're deficient in osteocalcin, you will start to develop brittle bones. Most postmenopausal females have less or deficient levels of osteocalcin in their bone. So it's critical to get the proper levels of MK7 either from your digestive tract, your colon, or from a supplement or from your diet. So make sure, again, you read your label on your multivitamin that it has MK7. Additional benefits of vitamin K, aside from bone health, involve the inhibition of calcium oxalate stones. So if you are a calcium oxalate stone former, vitamin K is really a critical nutrient for you to take in sufficient amounts. Vitamin K also has a very powerful effect as an anti-inflammatory agent. There are certain anti-inflammatory proteins in which vitamin K is involved in their synthesis. So decreasing inflammation in the body, vitamin K is an essential nutrient. In addition, some people have unexplainable itchiness of their skin, and this can happen for various reasons: essential fatty acid deficiency, zinc deficiency, but also vitamin K. So what we find is that if someone is deficient in vitamin K or taking suboptimal levels, they can experience general itchiness of their skin. And this is something that can be greatly helped with vitamin K. In addition, people that have spontaneous nosebleeds. Spontaneous nosebleeds are fairly common, especially in children. That's a classic sign that they're most likely deficient in vitamin K. And as we know, most kids, especially young kids and adolescents, tend not to eat a lot of vegetables, and hence they're much more prone to be deficient in vitamin K. More of a reason for them to take a good multivitamin that has MK7 in there. One last function on vitamin K is that newborns who are susceptible to hemorrhagic disease of the newborn, which can be a really serious condition, most physicians will recommend doing vitamin K shots at birth. However, if the mother is sufficiently supplemented with vitamin K throughout her pregnancy, then doing a vitamin K shot for the infant is not necessary. But as mentioned, most people, and most women for that matter, don't get enough vitamin K, and hence the baby will not get that sufficient vitamin K, and hence doing a vitamin K shot at birth is something that can be very beneficial prophylactically. So here's a special note on anticoagulants, specifically warfarin or Coumadin. Coumadin and warfarin are oftentimes given to patients who have problems with excessive blood clotting. So these are people that have an arrhythmia of their heart, or they have atrial fibrillation, rapid heart beating, or they have some type of artificial valve that stimulates blood to clot. So, and they need to be on these anticoagulant medications. Oftentimes, what is recommended is that these patients do not eat foods with vitamin K, which is actually the opposite of what you want. So to eliminate all of these healthy green leafy foods, green vegetables, is not in the best interest of the patient. So rather than to not eat foods with higher amounts of vitamin K, what you want to do is to make sure you get an amount of vitamin K every day that's sufficient to basically balance out the anticoagulant. So this should be done with the guidance of a physician who's knowledgeable about this information. But vitamin K is something that can be used as a supplement in people that are on warfarin or Coumadin. But again, they need to be monitored by their physician, and they need to make sure that their INR, which is a measurement of their blood clotting, is in the ideal range. And so rather than eliminate foods with vitamin K, take a vitamin K supplement, and then the amount of vitamin K in the diet won't really matter that much if one day is different from the other. So, but again, that needs to be something that you go over with your physician. Thanks for listening to another episode, Health Talk from Mars. It's out of this world. If you like what you heard today, click subscribe so you never miss an episode. If you like to support us, check out marsnutrition.net. And you can check out my multivitamin Omnivite. 40 years ago, I created Omnivite with vitamin K. I was one of the first formulators to do so. MK7, the special form of vitamin K that we talked about today, is in Omnivite. So if you want the ideal formulation for your multivitamin supplement, Omnivite is the one for you. Thanks for joining us, and I'll see you next time.